Life Healthcare has released their half-year results, which show an increase of 7.5% in operating profit during the period. Revenue also grew by 8.1%. The hospital group say its Southern Africa operations delivered a solid growth driven by increased patient activity and improved occupancy rates. CEO Peter Wharton-Hood joins me now. Peter, welcome to SABC News. Thank you so much for your time. You say that patient paid days, those rose by 2% compared to the prior period, as well as occupancies have also gone up nearly 70%. Perhaps let's start with the terminology about what we mean by patient paid days. How are those measured?
I think the easiest way to explain that is just the number of admissions we have into the hospital complexes. So if a patient arrives for 1 day, it's 1 paid day. If a patient arrives and stays for 3 days, it's 3 paid patient days, I think is the easiest way to explain it. And in the context of how occupancy is measured, it is literally what level of utilization we've got across all the hospital beds that exist across our complexes.
Yeah, let's talk about the driver of this growth across all your different operations. What would you say characterize this growth that we see during the period?
It's the culmination of a 3-year strategy where we took a deliberate view that we needed to increase the utilization of our hospital facilities, and we set a goal of trying to get back to the activity levels that were in the complexes before COVID. That takes a number of different initiatives to deliver, and it takes time for these to get traction. But if one summarizes the actions that we took, we concentrated on recruiting more specialist doctors to come and work in our hospitals and bring their patients to our facilities. We also negotiated new deals with the large medical aids, where in return for some discounts, they drove more volume to our hospitals as a preferred network provider. And the third approach was to selectively expand some of the existing facilities where the demand for services clearly exceeded the available bed capacity of the units. And in most of those brownfield expansion opportunities that we took, as soon as we cut the ribbon and opened the facilities, they filled up very, very quickly.
Wow.
So all of those added together produced a good result during the first 6 months.
Yeah. You talked earlier on about how you have recruited specialist doctors. And it reminds me about the time that we are going through as a country where the employment of doctors by the state is a topical issue in the country. So one of your continuing strategy has been obviously on that doctor recruitment and retention. How can your group help in this regard of absorbing the doctors that are there and unemployed?
Well, and that's a really good question for the benefit of the country, not just Life Healthcare. Life Healthcare is legally prohibited from directly employing doctors unless we ask for special concessions on a case-by-case basis from the regulator. So when we talk about recruiting doctors, we actually approach specialists and we offer them rooms and what we would call admission privileges into the hospital complexes so that they are allowed to bring their patients and operate on them in our theatres or care for them in the medical beds that we have available across the hospitals. Insofar as the role that private healthcare can play in addressing the challenges that we face as a country, Life Healthcare has a long-established reputation, which we publicly expressed, wanting to cooperate with government to improve the delivery of services across the nation and make hospital and medical facilities more accessible and more affordable. So we don't have outright access to be able to directly employ unemployed doctors, but we do extend the hand of partnership to be able to collaborate with government to seek ways to make the problem ease and make healthcare more accessible.
Peter, I wish I had more time to engage you, particularly on the budget that was tabled yesterday. Unfortunately, I don't have much time to have that chat with you, but I do thank you for making time to speak to us here on the SABC News channel. I've been speaking to the CEO of Life Healthcare, Peter Wharton-Hood, and we've been talking about the financial results which were released earlier this morning.